Hello viewers, and welcome to our discussion today. Today we'll be talking about mental health, and just as a recap, let me remind you that health is a state of complete physical and mental health, and not just the absence of disease. So we have ventured before in physical health to discuss about hypertension, diabetes, but now I want us to shift gears and discuss the second and very important part of complete health, which is mental health. So welcome, and with me here is Dr. Carol, who will be taking us through the definition, what is mental health, and she'll also be telling us about the different modules of the same. So Karim, Dr.
And today we'll talk about mental health. As we know, there is a definition for mental health. The definition by WHO, it explains mental health as a state of well-being in which an individual realizes his or her own abilities and can cope with the normal stresses of life and can work productively and is able to make a contribution to his or her community. Looking for mental health can help a person become happy or can even give ability to enjoy life. It involves a balance between life and responsibilities and efforts to achieve psychological resilience. Although everybody thinks mental health is a common name for common conditions, doctors actually relate mental health to physical roots. So today we are going to discuss risk factors and know who is at risk of getting this mental disorder. We are also going to discuss types of mental disorders. We are also going to discuss how to prevent them and also how to manage them.
In the past, people thought that mental illness are the people that walk on the streets collecting bags and plastics and untidy and unkept. But now studies have shown, as Dr. has defined it, it is not just limited to that. You can be well dressed and kept, but with a mental illness or a subtype of mental illness. So let me talk about some misconceptions or some half-truths, and then Dr. will come back and continue on the risk factors. People have thought that probably you can visit your family friend in the evening and talk yourself out of a depression or a depressive condition, or visit a session with your pastor with all due respect and deal with a mental illness. But studies have shown some of these mental illnesses, like schizophrenic disorders, require a proper diagnosis and very clear treatment modules, and not just probably a motivational talk. So this is why this is very important, to be able to diagnose a mental illness, exactly what it is, and then from that you are able to engage in the correct treatment, and not just perhaps assuming that you are just demotivated in life, or you are not able to handle a few things. No, it can be a clinical diagnosis that requires proper treatment. By treatment I mean drugs, and maybe not just a counseling session, so to speak. So Dr. will welcome to continue with the risk factors and who are at risk of developing mental illnesses.
Okay, so let's talk about risk factors. We have two major risk factors. One of them is continuous social and economic pressure. Most of us experience this from workplaces. The work can be very intense or very busy, which can give us social pressure. Also occupational hazards, level of social involvement, for example in social media. We also have the responsibility of employment burden. Most of our people don't have they're not employed, and the ones who are employed have to cover their bills, which gives the employed one and even the non-employed one mental disorder. Also, there are non-modifiable factors like gender. You can get some women being discriminated or some men being discriminated. Also, age, ethnicity, all these things, they put people at risk of mental disorder. Biological factor. That one most of us do not have control of. It is where genetic family history can increase more chances of getting the mental condition. For example, that is when you have a gene that puts you at a higher risk of getting a mental disorder. Let's talk about mood disorders, also referred as depressive disorders. They are divided into major depression and bipolar disorder, seasonal affective disorder, and common major depression. Let's talk about major depression, which actually attacks most of us. It is a constant of low moods. People feel like they are in sadness for a long period of time. Also, bipolar disorder is where somebody experiences changes in moods, so that's where even personalities change. They have a very ambiguous personality at this point and very loud, then another calm and depressive and silent mood. So these energy levels, they keep changing, but they are able to continue with the daily life. There is seasonal affective disorders where light of the day can affect a personality. So these people, they have personalities. During the night is different, during the day is different. There is now also common major depression where people don't socialize with anyone and they end up sometimes causing suicide. There is also obsessive compulsive disorders, OCD, which many of us have gotten after COVID, where we fear bacteria on surfaces. We keep washing hands every time, we keep sanitizing our area, and we do it repetitively until it is a disorder. Then there is post-traumatic stress disorders where our Marines, our police, our KDF experience when they go to battle. Also domestic violence, which can give them these post-traumatic stress disorders. They are not able to run into relationships. We have just talked about risks, and now we want to talk about common health disorders. They are divided into three. One of them is anxiety disorders, then mood disorders, and we also have schizophrenia. I'm going to talk about anxiety disorders. My colleague, Dr. Jeffrey, will talk about mood disorders and schizophrenia. Let's start with anxiety disorders. We start with panic disorders. One example is panic disorders, where sudden overwhelming terror of death or disaster overwhelms someone. Then there is phobias. There is simple phobia. Simple phobia is where we fear objects like knives, like sharp objects. You can fear round objects. There is also social phobia, which many of us have. You can't appear on a camera, or you cannot talk in front of many people. Yeah, there is also agoraphobia, which is fear of situations where getting away might be difficult.
So far we have seen the two types or the classification of mental illnesses, the anxiety disorders, the mood disorders, and now I will take you through the third type of mental illnesses, which is the schizophrenic disorders. Now, this is the most complicated and most serious type of mental illness. Most of us, most of you viewers, what you know as mental illness, people running, screaming, people collecting papers, such. That is now what we are talking about. This is now the third model, which is schizophrenia. That is the most complicated and the most severe type of mental illnesses. but you realize that there are other types and models of mental illness. So what is schizophrenia? It is a serious mental disorder in which people interpret reality differently. In other words, they lose touch with the reality. They hear sounds, they hear delusions, hallucinations. They say people are chasing them, or they are hearing people are screaming, or they are seeing people in their bedroom or when they sleep. This is what we are talking about when we talk about schizophrenia. So it is a serious mental disorder, and it may result from a combination of these things. It may result from the other types that Dr. has mentioned of mental illness. People with schizophrenia require lifelong treatment. That is very important for us to realize. It is not something that you can sit people down and talk them out of it. No, it is something that requires lifelong treatment. It is not very well known what causes schizophrenia. It is suspected that some genetic predisposition. That's why sometimes you see it in families, running down in families, or that family history of mental health. You see of mental illness, you realize that there is a history of somebody that had such condition in the family. So it is not very clear what causes it, but it is suspected that genetically there is that predisposition. What are some of the symptoms of schizophrenia? Delusions. This is very important. What are delusions? Delusions are false beliefs that are not based in reality. You see somebody believing or saying that I am the president of Kenya, something like that, and they stick to that and they believe it. They are the governor, or they are the something that they are not. So those are called delusions. Loss of reality or loss of touch with the reality. Then there is hallucinations. The hallucinations is seeing or hearing things that don't exist. They hear sounds, they see things which are actually not there. And then there is disorganized thinking. You see sometimes they are coordinating, then sometimes they lose that. It is disorganized kind of thinking. Sometimes they will be okay and well coordinated, and then they are not at others. So that kind of disorganization also, those are some of the symptoms of this. So that is very important, and when you look at that, you are able now to see, when you come across somebody, you think, have you noted things like delusions, hallucinations? Are they losing touch with reality? Then you begin to think that this is most likely schizophrenia, and you know that these are people that require treatment for life to be able to keep this condition under proper management. Now, let me talk about what are the complications of these illnesses, including what Dr. has mentioned before in terms of the anxiety and mood disorders, and now schizophrenia. What are some of the complications? The complications, number one, or one of the leading complications, is suicide or suicidal attempts and suicidal thoughts. And I know this is in today's community or in today's society. You won't go for a day or two without hearing or seeing somebody that has committed suicide. So suicide is one of the top complications. So understand, people say think that suicide is something that is something selfish. No, it is not. It is a complication of what has been going on in the mental aspect of this person. It is a result of. Another thing is abuse of alcohol. People think again that excessive use of alcohol is lifestyle, or it's tabia mbaya. No. Use of these substances like excessive use of alcohol, smoking, they are just complications or resultant conditions from already existing mental illnesses. And so trying to tell a person like this, wacha kuvuta sigara, wacha kunywa pombe, it won't work. It is dealing with the complications when you have not dealt with the underlying conditions. So that is another complication of these illnesses. Another one will be, of course, inability to work. they won't be able to focus at work. They will keep changing work, being fired from one place to another. They will miss work. These are inability to work. That combined with financial difficulties, because they are not even able to perhaps manage resources properly, so they will get into financial problems, homelessness, and they will keep moving from maybe one brother to the sister to the other brother, and because they are not able to live in or to pay a house, so they become homeless. You see this kind of things in somebody that you know, and do not, the way we say, judge them, but please understand these are the complications of an underlying mental condition. Aggressive behavior, that is very significant. You've seen wars in people fighting on the streets and such things. If you see that aggressive behavior, again, it points to an underlying mental illness, and these are people that need help, and we should be able to help them now after learning these things that we are talking about. There is the anxiety disorders and obsessive kind of tendencies that Dr. was mentioning. It can also now come to a degree that it is a complication. You're not able to, you are so obsessed with something. You've seen people who, after they have been left by somebody they loved, they cannot hold together, and you see them go back, especially in teenagers. They go and want to kill those people, or to poison them, or to poison themselves because they have been wamewachwa na somebody that they loved. So that is obsessive compulsive disorder, and it is a complication of these mental illnesses. So you will realize as we go along, most of the things that you're seeing in the community today, they are not just random. They are complications or indicators. But if the community does not know this, then we will end up isolating them, and we will end up in the state that we are in, that we are having suicides every day, and people killing each other, burning each other inside houses because of this. So those are some of the complications that I can put through, and we can be able to use that to make an informed decision.
So how do we prevent these mental disorders? One is taking steps to control stress. So how do we control stress? We divide stress into three. One, stress that you can handle. Two, a stress that you cannot handle, you forget it or you ignore it. And three is you do away with the stressor. Then also you can be physically healthy and active. You can have an exercise routine. You can make sure you're eating right. That helps to keep balance of your hormones, and you might not go all the way to mood disorders. Also connect with others. Staying alone or being in solitude can trigger so many mental disorders. So always connect with others. Then fourth, you need to stay positive. Negative people tend to get more mental disorders than positive people. So let's try to stay on the positive side of life. Then there's sleeping well. Make sure you have your daily 6 to 8 hours sleep. It helps with mental health. There is also paying attention to warning signs and getting medical help. Daktari has talked about noticing an aggressive person in the community, noticing an angry person, or somebody who is having hallucinations or having delusions. Once you notice those are warning signs, that person needs to get medical help. So you get your loved one into a medical center and they get the help they need. Also, avoid alcohol and drug abuse. Alcohol and drugs interfere with the way we think. They interfere with the way we act, and they interfere with our moods. So that can easily put us to mental disorders very quickly. So we need to avoid alcohol and drug abuse. There is also training of our youth. we need to inform them. We need to sensitize people about mental disorders so that they are able to take control before it really gets to suicide or even other complications. We can really, if we are informed, it is less likely that we are going to wait until this person is causing a death.